Hello and good morning. In the previous lecture, we covered the renal physiology, and now we will cover the renal pathology, meaning what's wrong with our kidneys. Okay, so here's a little pun that bird is carrying the stones. We have three kinds of stones: gallstones, kidney stones, and bladder stones, which go from the kidneys to the bladder. Okay, so kidney disorders. These are the diseases that affect the kidneys, and they usually affect both kidneys, and they affect the ability to remove the waste products and control water balance. And and then there is the accumulation of waste products and fluid causes severe uremia, and uremia is equal to kidney failure. What are its causes? Hereditary disorders, inflammatory and non-inflammatory, congenital diseases like cancers, lymphoma, etc., or multiple myeloma. Then there are the kidney stones, which can happen before that calculus forms. And then there are the renal tumors, polycystic kidneys. Okay, so signs of kidney problems. There is proteins, blood, or glucose in the urine, and the GFR is usually assessed to confirm kidney disease and determine the amount of inulin excreted. Okay, inulin. And if the GFR is fallen, the kidney disease is obvious. Okay, inulin is excreted as it is in the body, and without it is not saved in the body. Okay, it is excreted as it is. Okay, so what are polycystic kidney diseases? This is basically a hereditary disease, and it is caused by the mutation in the PKD gene, which causes defects in the uptake of calcium, and it leads to the formation of cysts. There are many cysts, small cysts in the kidneys, just like this above on the surface. Kidney enlarges due to the presence of hundreds, thousands of renal cysts that can be up to 20 centimeter in diameter, and it causes uremia, which is kidney failure. Okay, so this is a cyst forming. Okay, this is a very big cyst. Okay, maybe a 20 centimeter cyst. Okay, so what are kidney stones? Renal calculi. Urine basically becomes saturated with salts of calcium, phosphate, oxalate, and urate. So its pH changes, and if the pH changes, it favors precipitation of the salts and hence the formation of stones. If there's blood in the urine, it is called hematuria. Okay, and kidney tumor dissection. Basically, these are the tumors being formed. Okay, these are the tumors. Okay, there's also the cancer of urinary tract. It involves the fats around the kidneys. There are 3 layers around the kidneys. Okay, the last one is all fats, and its symptoms are hematuria, pain, and the surgical removal of kidneys is the treatment. Okay, nephrotic syndrome. Basically, there is the loss of podocytes, and the slits become enlarged, and then proteins can pass through it, and increase in the urinary protein secretion, which causes proteinuria. Also, it can let the blood in the urine too. Proteins and blood can also be found. Okay, so this is basically the whole structure of the glomerulus. Okay, this is the afferent arterioles. Blood is coming from here, and exiting from here. Okay, these are the smooth muscle cells, and these are the macula densa cells, and this is distal convoluted tubule. It is present in the end. Basically, this is a cut section, and blood is coming inside, and these are the podocytes. Okay, these are the podocytes, and these are the juxtaglomerular cells. Okay, these are the mesangial cells. This is the basal lamina. This is the urinary space. This is the basal lamina as well. This is the proximal convoluted tubules. It goes from here to here to the distal convoluted tubule, and between that there's the loop of Henle. You got the point now. Okay, there's one syndrome called Alport syndrome. It is inflammatory in nature, and basically there's the inflammation of the glomerular capillaries, which is called glomerulonephritis. Itis means inflammation. So the basement membrane becomes irregular in thickness and fails to serve as an effective filtration barrier to the blood cells and proteins. Irregular in thickness. Okay. So what is incontinence? It is caused by inability to control voluntary micturition. Okay, so our micturition is voluntary. If we cannot control it, it is called incontinence. What is micturition? It is the releasing of urine naturally. Okay, and if basically releasing urine from the bladder, peeing in slang language. Okay, its causes can be age and emotional disorders in pregnancy, damage to the nervous system, basically to the spinal cord, stress, excessive laughing and coughing, leads to the wetting of clothing, discomfort and embarrassment. Okay, its treatment can be drug therapy, change in lifestyle, in exercise, diet, water intake, or dialysis therapy. Sorry. Drug treatment. Okay, its treatment is very effective to relieve the pain in conditions such as renal calculi. Okay, this is the drug Ropacinex. It relaxes the urinary tract spasms and allows the easy passage of kidney stones into the urine. Okay, what is dialysis therapy? Okay, that it artificially removes metabolic waste from the blood in order to compensate for kidney. This is a machine for dialysis, and this lady is getting her dialysis done. It takes, I guess, 3 hours. Okay. Basically, there's hemodialysis of blood, and the patient's blood is transported to a semi-permeable tube into the apparatus which contains dialysis fluid. It creates a diffusion gradient. It absorbs the material. The abnormal substances diffuse out the blood and cleaning it. What is its purpose? Its purpose is his 2 kidneys cannot filter blood basically, and end-stage renal diseases patients are recommended dialysis. Okay, thank you for listening to us. I'm happy that you know more about me. Yes, because all humans have kidneys. And if you have any questions, you can ask me in the comments. I'll be glad to answer them. Please like, share, and subscribe. And thank you for listening. Goodbye.